Tonight's health news has to do with drugs found in so many American homes, the ones often prescribed for patients after surgery or an injury, the pain relievers and prescription pain meds that contain acetaminophen, the active ingredient in things like Tylenol. The FDA is taking action to limit the amount of acetaminophen in prescription meds because overdosing on acetaminophen is the most common cause of liver failure. Our chief medical editor, Dr. Nancy Snyderman, is here with us with more on this. Nancy.
Hey, Brian, the FDA was very pointed today in why they've taken this action, and it has to do with the fact that so many people don't know that acetaminophen is a common component in prescription painkillers like Vicodin and Percocet. Patients a lot of times decide to add additional over-the-counter acetaminophen without realizing that they are at risk for liver damage. And that's why the agency is asking doctors to stop prescribing medications, combination medications with more than 325 milligrams of acetaminophen per dose. It all boils down to why today's announcement is so important. It targets the prescription painkillers. It's a reminder to keep the dosage down to common levels. That is, don't exceed more than 4,000 milligrams in a 24-hour period. That's usually about 8 or 10 pills. Ask your doctor, what is the content of the acetaminophen in any prescription painkiller? And finally, remember, alcohol is not your friend when it comes to acetaminophen, so don't drink when you take this medication. And it's a reminder also that for most pain that isn't severe, when you just need an over-the-counter medication, one pill, one 325 milligram pill can sometimes take care of routine pain. And there's no evidence, interestingly, Brian, that 2 pills is better than 1.
And in that way, this is big news today. Nancy, thanks as always.